Hi, I'm Jim Sturdivant of Face It Together. Now, Face It Together is a team of social entrepreneurs working to solve one of our nation's costliest health problems, addiction to alcohol and other drugs. Now, if you attend our workshop, you will learn how Face It Together is striving toward its bold vision, a nation that understands and treats addiction like any other chronic disease. Chronic, as you know, marked by long duration. And there's 22 million people in our nation who suffer from addiction, and multiply that times 3 or 4 and you get the number affected by addiction, and many of those are children. Yet 90% of those who need help don't seek help in any given year, and 75% will never get help in their lifetime. In most communities, addiction is treated like an acute disease, an emergency room approach, but it's not treated like a chronic disease. The Face It Together model is designed to change how a community deals with addiction and treat it like a chronic disease. Now, for over 3 years, Face It Together has operated a recovery community organization right near the middle of the country in Sioux Falls, South Dakota. The Face It Together recovery community organization is actually a hub of a wheel. Here's the Face It Together model. It essentially has 3 lines of business. One is to work with social, private, public sectors in the community to advocate for this chronic cure approach to addiction. The second line of business is awareness. We run an awareness program to help the community reduce stigma across all sectors, remove fear, shame around this disease. Third line of business is to serve as a clearinghouse and meet recovery needs for people coming into the RCO, people seeking to initiate and sustain recovery. All 3 lines of business are brought to bear with employers. This is a very unique aspect of our model. In Sioux Falls, South Dakota, there's 24 employers working with Face It Together to bring this model right into the workplace. Employers get a return on their investment through reduced attrition and absenteeism, lower health costs. And each employer then provides funds to help support and sustain the recovery community organization. Undergirding this model is an evaluation model, so we can measure outcomes and measure progress. Also, one more point, we're working with healthcare providers. Healthcare providers serve the medical needs of people with addiction who come forward, but they need to work with this community organization, and we're developing the partnership to work with health providers and round out an addiction chronic care model in a community. So we're also providing our experience and tools to other communities. We're proliferating our model to other communities in the upper Midwest first, before we take it to other communities across the country. So Face It Together marries social mission with business principles. And at this intersection is where Face It Together is addressing the chronic disease of addiction. We look forward to seeing you at our workshop. We'll have a great discussion, and we'll face it together. Thanks.